Bonjour. Good afternoon, everybody. My name is Kyle Hill. I'm an assistant professor at the University of Minnesota at the School of Public Health and the Division of Environmental Health Sciences. I'm enrolled in the Turtle Mountain Band of Ojibwe and a lineal descendant of the Sisin-Wapton, Oyate, and the Cheyenne River Sioux tribes. It's a blessing and a privilege to be here, so I feel very welcomed. And also, I just also wanted to give thanks to the Abenaki nations, who have historically stewarded these lands over since time immemorial. And I think as a beginning, that's where my work starts. I primarily look at the impacts of climate change on Indigenous health, and more specifically on the mental health impacts of climate change on Indigenous health. And with respect to climate resilience, I look at the utility of Indigenous traditional ecological knowledges for climate adaptation programs and mitigation programs. And I just wanted to add a few pictures, illustrations of kind of some of the work that I do and also some of the roles that I have at the University of Minnesota. Right now, our communities are recognized as most vulnerable to the impacts of climate change. And so when we think about things like mental health, what I think about is the ecological grief we experience as we're reclaiming our traditional ways as a result of the impacts of colonialism. We also have to consider the very real and raw challenges that we're seeing in our communities now with eroding traditional activities and systems that we rely on with our connection to our lands and ecosystems. So some of our communities are experiencing some of our traditional foods. For example, in my community, chokecherry stands, they're sometimes not where they used to be. They're shifting, or they're just, some elders are reporting that they're not there, period. In the Northwest, we've heard of some of the dams in the Klamath River that have been removed. So salmon fisheries are being reclaimed and they're actively, becoming more resilient. So those are some of the more beautiful aspects of what's happening. And so right now, well, I guess I should say a paper that's in review right now, we're looking at how traditional activities, spiritual activities and cultural activities are related to positive mental health. And so that's a really promising way to get at some of this work. But with respect to our Minnesota Center for Climate Change and Health, it's really a developmental center that we just received that grant. So as the PI on our community engagement core, we're looking at developing climate change and health research agenda. And so that's going to be our main one, but also like a place-based, looking at how place-based activities are important for Indigenous youth in our region, Minneapolis, St. Paul, and the tribes. And then I want to also note that I was one of the authors on the status of climate change, status of tribes and climate change, volume 2, which is coming out pretty soon. And so you'll note that that figure, the framework in the middle, is from Status of Climate Change and Tribes, Volume 1. So that's coming out very soon. And I also want to point to a manuscript that we just published this past year on Indigenous peoples' traditional knowledge, climate change, and health. That's going to really support our use and be able to elaborate more on the connection between traditional knowledges, climate adaptation, and mitigation. So again, thank you, and miigwech. It's a privilege to be here with you all. Yeah.